Well, welcome everyone. Welcome to the MGMA Member Spotlight podcast. I'm Daniel Williams, Senior Editor at MGMA and host of the MGMA Podcast Network. We have two guests here today. We have Delores McNair and Bryana Blanco. Delores is Division Administrator of the Spine Division across the departments of neurosurgery and orthopedics at Duke University School of Medicine and Duke University Health System. And we also have Bryana. She is the Nursing Development Specialist at AdventHealth. We have Delores and Bryana here today. They're talking about a really cool member benefit, member program that's at MGMA, and that is our mentorship program. So I want to just welcome both of you, both Delores and Bryana, to the podcast.
Hi, thank you so much.
Yeah, it's
glad to be here.
Great having y'all here. So what I want to do with all of the MGMA Member Spotlight podcast is get to know y'all first. We are going to do a deep dive into the mentorship program, but we want to know who we're talking to. So Delores, I'm going to start with you. Tell us a little bit about your healthcare journey and maybe share a few highlights with us about that.
Well, when I look back, as I've learned so much about MGMA, I see it reflecting a story I didn't know would be told about my healthcare journey. I started out as being the only college attendee in my family, struggling to find a way to pay for it, and was working as a temp in healthcare in a non-clinical role, and was so fortunate. Mentorship is so important. Someone saw me, thought I would make a great professional of some type. They weren't sure yet, but they thought I should get into healthcare, help me find a way to get back into school. And I literally have worked my way. I tell people I was once a courier delivering blood products, to sitting behind a desk, to crunching data, to learning scientific principles. And my mentors helped me all along the way. And one day I found myself in administration in the healthcare world, and I love it. And now a part of MGMA, loving it too.
Oh, that's a wonderful story, Delores, and thank you for sharing that. Bryana, would love to hear a little bit about your healthcare journey as well. I know you and I were trading a few emails offline before we got started. I was getting your bio in front of me, but please share that with our audience as well.
Yeah, absolutely. Well, my healthcare journey is on the track of going through medicine. As Delores has shared from her journey, I am very similar in the fact that I am the first to go to college in my family, the first to enter medicine. But since being very, very young, I knew that I wanted to be a nurse. So my background is that I am a registered nurse, graduating with my BSN, and that was at the peak of the pandemic. I graduated 2020, May of 2020. I will never forget that I was in my practicum in a multi-system level 1 trauma center, and I'll never forget the time that we were caring for patients and we did not know why they were so sick, why the acuity was so high. Come to find out, it was COVID we were facing. Spending 5 years at the bedside caring for patients, 2 of those being direct intensive care treatment for those patients. It's been an amazing experience. And in that bio, I shared, that passion that grew from wanting to care for a person because, as Delores said, someone saw her and I've been cared for by so many. I just wanted to do that in my career. And then I kind of understood that the only way that our healthcare professionals can care for others is they're cared for by the system, by someone, and that's who I want to become. So I'm actually obtaining my master's in healthcare administration through the University of North Florida. I'm set to graduate this spring 2025, and I'm hoping to combine my clinical expertise to that passion of just wanting to ensure that our healthcare workers can continue to do what their passion is to improve the health of our community.
Wow. Bryana, what an incredible story that is. If this is your calling, this was a time to be there for sure, with it being the pandemic. I wanted to follow up a little bit with you, stay with you, Bryana. North Florida, is that in Jacksonville or where is that located?
That is in Jacksonville. I have grown up in Florida. I've been everywhere in Florida. I was born and raised in South Florida, Miami girl,
Okay.
But I currently reside in Orlando. So that's where my institution is, AdventHealth. We are a huge organization. We have been spreading across the nation here, but I am home to our Orlando campus.
Oh, okay. Well, that is so wonderful. So if you could just share a little bit about that affiliation with MGMA, then this is that MGMA Member Spotlight podcast. We've got different shows, but this is one where we really want to get to know the MGMA members better. So talk about how that affiliation got started. Anything else you want to share about that?
Yeah, well, I'll be honest with you. I was Googling. It was a quick Google search. I was kind of entering, and as I was an ICU nurse, and I was kind of growing in my professional skills as becoming a charge nurse, a leader on that floor. I was just looking as to, what can I do as a leader in healthcare? What does that look like? And like I said, I was the first to go to college, and everyone still calls me Dr. Blanco. My parents still think I'm a doctor. And I just say, yeah, that's fine. But I didn't know how to navigate this career, how to grow, and MGMA found me, truthfully. I was on the website, the platform, the resources that were already free, and it really just opened the horizon to what healthcare can be, both from a clinical perspective, but to an administrative perspective. Coming from the clinical side, everyone is scared of administration. Everyone is, oh, they're walking by, don't make too much eye contact there. But I wanted to change that because all the administrators that I have met, including Delores herself, have been so kind, and they truly do care in a way that is greater than when we care for the direct patient experience that we have. So I joined as a member myself, and when I found the program I'd be pursuing my master's in, they actually encouraged it. So UNF is a huge push for putting us into the MGMA program. And then I just had to have the opportunity to find a mentor because, again, I was just seeking guidance into where do I go? What is next for me?
Yeah, and we'll get into that mentorship program a little bit deeper. I did want to follow up, though. So your title, when I looked it up, you sent it over to me, was Nursing Development Specialist. What exactly is that? What's your day-to-day look like there at AdventHealth?
It's a great question because I recently just got promoted into this role. So Congrats. I was asking myself, thank you. I was asking myself what that is. So as a nursing development specialist, my day-to-day is transforming from the 12-hour shifts more so to that Monday to Friday, 8 to 5. But I work hand in hand with all of our student nurses. So those are our students who are actively working at the bedside in the hospital. And I make sure that I am part of their growth, being academically, so I support them through their schooling. I work with all schools in Orlando that are promoting LPN, ASN, and BSN degrees to our nursing students. Then in the system themselves, I work with all of our managers and educators to promote that hierarchy of growth. So we try to ensure that we find them a best match based on their interests, ensure that their managers are growing them into residency programs. So it's a lot of back and forth communication, one-on-one studying tips, and I absolutely love it because I did not have that as a student. I really do resonate with what Delores said. I pushed myself through school. I was actually denied my first nursing school application. I had a 4.0 GPA and they still said I wasn't good enough. Shocking enough. Wow. But it didn't stop me. I kept going and I had to pay for school out of pocket. I still am pushing through. And I just want to be someone that a student can lean on as they're navigating their own career.
Well, that's incredible. Congratulations on that. And Delores, Delores, I wanted to come back to you and just hear a little bit more about what you're doing at Duke right now. I see that you're in that neurosurgery and orthopedics division. Talk about that a little bit. What does that day-to-day look like for you?
I think it's very reflective of what MGMA is. When I learned about MGMA, it seemed like such a big name, a big title, and I was fortunate. Mentors, again, helped me. And some of those mentors were frontline practice managers, which is a large component of the membership of MGMA. And as they exposed it to me, the program of MGMA, they started saying, do you know the difference between a department and a division, between a section head leader, between why we have people at the front desk collecting copays? Do you understand how that falls into the whole scheme of healthcare? And more and more, my mentors just kept exposing me, taking me to meetings. And those who were involved in MGMA did not realize I had not joined because, like, Bryana said, my budget was tight and I could not afford individual membership, only to learn that one of the greatest benefits of MGMA is there is institutional membership as well as individual. So my mentor actually funded me for individual, but then when I joined Duke University Health System, I was able to also be benefiting from the institutional. And that led me to go, now that I know a division, a department, a section, where do I fit? Like Bryana said, I was once on the clinical side, once, near the bedside, seeing patients up close, but I liked the administrative side. MGMA, the people I met that were administrators were so kind. They were very friendly, so willing to teach. And I thought, I can do that. And they were saying I could. So now I do what I used to see them do. I work on budgets across multiple departments, recruitment of faculty, including MDs, surgeons, physiatrists, chiropractors, APP, advanced practice providers. I liaison with nursing leadership. I also have administrative oversight of the Spine Fellowship Program, administrative oversight of our clinical research unit, which includes not only our principal investigators, but as Bryana talked about, students. We have medical students, residents, fellows, as well as our surgeons and our MDs who do great research to improve the outcomes of patients. I get an opportunity now to just step into almost every realm of administration. And when I find there's something I don't know, I recently got my certificate through MGMA on data analytics because I knew data analytics, but I needed to hone some skills. And again, I was able to see how all these facets of my day-to-day work, whether it's a 6 a.m. meeting, because I have those, or a 6 p.m. meeting, and I have those too, MGMA had something that either helped me before I got here, when I got here, or now when I want to learn a new skill because I want to go higher and higher in administration.
That is awesome. And to you as well, congratulations. You had mentioned earlier, first one in your family being a university grad. And that's really exciting. That's such a cool story. Let's talk about that mentorship program then. Let's stay with you, Delores. For our listeners who may have never even heard of the mentorship program at MGMA, and I will be very transparent here until my colleague Amanda Jensen brought it to my attention, I wasn't aware of it either. There are a lot of programs, as both of you know, at MGMA. And so sometimes some slide under the radar. I don't know about them. So I would love for you to share with our audience a little bit more about that program, maybe how you learned about it in the first place, and then anything else you might want to share about it.
Well, I would tell anyone listening, if you've never heard of MGMA until you're listening to this podcast, get on the listservs. Go to the website, and everything you see that you do know what it means or what they're talking about a little bit, sign up for it. If you don't know, send an email. There's always an info link right there where you can ask about it. So I, too, had not heard about MGA Mentorship Program until maybe the last year and a half. I knew there was mentoring going on. I didn't realize how great they laid out the plan for it. And I mentor people literally all year long. I'm not only looking for people to mentor, I'm looking for people to mentor me. And I wanted to give back more. People such as Bryana are people that whatever I can learn from her and whatever I can share with her, you can't miss these opportunities. So when I was on the listservs and on the MGMA website, I'd heard someone talk about it at one of the conferences, and I came back to work and I started looking and I went, get out of here. This is pretty neat. This is pretty awesome. And so I immediately reached out. Amanda Jensen was a wealth of information. She too was so friendly, so warm. And she teased me because she said she could hear how passionate I was about mentorship. So what the program does is it's structured, but I feel it's flexible. The aim is to pair you with a mentor as best possible that suits what the mentee expresses as their desired need, but yet they are aiming to get you paired up. They are not just soliciting any and everybody. It's people who want to willingly volunteer, or maybe like yourself, one of us who's a member of MGMA hadn't heard about it, but now we have. Pairing you with individuals who have either achieved where you might want to go, has a skill set you don't have or you'd like to improve or strengthen, or total networking. Sometimes it's just about networking. Mentorship doesn't have to be about just a promotion or a pay raise. It's really about building a total package. I tell people mentorship is relationship, and MGMA is about relationship. So the mentorship program aims to create relationships and networking for the mentor and the mentee across all of the United States that equips you with information, tools, knowledge, so you can do just like Bryana did, because she did the work, she did the searching, she did the schooling. You can achieve the next level and the next, because I'm confident for Bryana, there is no limit, but more than that, the next promotion is just around the corner. I don't anticipate. She's a prime example of why the MGMA program will continue to be successful, because I'm confident the feedback, the contribution, and the highlights she will get in her life and her professional career will shine even more brightly on the program.
Well, Delores, I agree with Amanda. Your passion just shines through, and I appreciate it. We need to get you in a PSA or something like that to market this program. Wow, that is incredible. So thank you for that. I want to turn to Bryana. Talk about the program. How'd you learn about it as a mentee? What did you go into it for? You know, you're starting out that career. You were saying you were still in school around the time the pandemic started. So you hadn't been in your career for a real long time, a few years. So when did you start seeking out this mentorship program, and what were you hoping to get out of it?
Well, as Laura said, MGMA sets you up for success. And what I really did appreciate is the different levels of membership that it offers, that including it being something that students can afford. They truly understand the resources that they can provide, but they're real with it, right? They understand that we are students and we're still learning. So as I signed up on my own through our student membership, I was granted so many resources. Amanda herself reached out to me directly through email, linking me with scholarships, linking me with the mentorship program. And it was kind of at that point in my career where I was already set on the fact that I had contributed, I have learned a lot at the bedside, and I was just looking for someone to hold my hand and guide me to the next step. I wasn't expecting, a job offer or anything like that, although MGMA has that very nicely organized on their webpage, and I was scrolling through those job listings quite frequently, not just to apply, but to learn what the names mean. What is the verbiage that is being used in the world of administration? Because again, I was clueless. So it was a simple application. You just submitted your personal information. What were your interests? Again, as Delores said, it was probably something to be best matched. And I couldn't have been paired more perfectly, because Delores is, as you heard it as she speaks, she's just amazing. I would be honored to do half the things that she has done in her career. When she spoke, the first time we spoke off the bat, she was just already enlightening in me the leader that I could be. I've cried with this woman here. So she's truly been amazing. So I think, although if you've never heard of it, it is something truly so easy. If you're seeking mentorship, if you're seeking something of just guidance, someone to talk to, networking, learning what there is out there, it is truly for everyone. It's not just for students. I think anyone who is at any point of their career can benefit from mentoring, as I have learned that I will need a mentor for the rest of my life, truthfully. So I'm really appreciative of how easy it was. And the process, the commitment is not something, that you have to put too much time into it. Again, it's very flexible. It is based off the mentor and the mentee's communication availability, and it's just really amazing for growth.
Yeah, Bryana, I want to stay with you then. So walk us through then, what is the commitment that, at least in the case of you and Delores, how much time are y'all spending together? What does that time together even look like? Because I don't think y'all are in the same area. You're in, I guess, Orlando, and Delores, you're at Duke. So I guess it's through Zoom. Walk us through that. What is the process like, and what are your meetings like?
Yeah, well, technology definitely helps us all in the world that we're living with. But you do, so once you get that match, you get an introduction email that this is your introduction to your mentor, and your mentor gets an introduction, this is your mentee. It provides a brief summary of their experience, a little bio as you asked for me about myself.
Right.
And you can just it's just a brief summary of who they are and what they can do. Now, the interesting part of the MGA program, which I really did appreciate because it pushed me to learn, again, I come from the clinical aspect where all of my communication is directly face-to-face with a doctor, with a provider. The mentee is the one who is supposed to seek the mentor first, to open up that door and introduce themselves and thank them and share their availability and the preferred method of communication, whether that be text, call, Zoom, FaceTime, however method you'd like. And I think I was intimidated by that fact because I read Dolores's bio and all of the amazing things she did, and I was like, there's no way I'm paired with this amazing person. Like, I'm I would simplify myself and I'd be like, I'm just a nurse. I have no idea how I can have a conversation with someone who is so pristine. And because of how amazing Delores is, she even reached out to me first.
Wow.
But again, I do think that push as a mentee to kind of grow professionally is how the program is set up. She did communicate with me. We finally shared that availability. We met through Zoom. And it was great. I was, respectful of her time. She was respectful of mine, but she was open. And as a mentor, that is something that, you can only hope to have. She was able to meet with me at any time. She gave me her cell phone number. She said, text me, call me. I mean, she doesn't even know me. And for her to be that open made the program to be so easy, right? So as this is all happening, I'm in that transition phase where I'm interviewing for new jobs, finally get this promotion, and I'm kind of in this whirlwind. And having a mentor as strong as Delores, being able to one to reach out to make sure I'm okay going through this, really grounded me. And I think one of our conversations through Zoom was my biggest fear is transitioning from 13-hour shifts, just 3 days a week, to now having to work Monday to Friday. How do I know what's important? How do I complete this to-do list? How do I prioritize my time when I am now cut into the small period? And she has shown me how to do that. This woman has so much on her plate, but she still found time to communicate with me. She always spoke with me professionally, openly, as a friend, as a mentor. And that's truly, I think I would hope we can just make Delores the mentor for everyone because she's truly amazing.
Wow, that is a great testament to Delores. And Delores, I have a question to ask. Will you mentor me?
Well, we mentor each other. Remember, it's about relationships.
Right.
And Bryana will tell you, I said to her, because we knew our time was tight.
Right.
Bryana is an example of what the world needs, but what the world doesn't realize it already has. She's committed to her profession, but she's committed to human beings, not only her family, but her community. And with that said, I think people are always looking for formal mentorship, or they think they can't be a mentor unless they have this long bio. And what I loved was that I've been where Bryana was. I thought, she hadn't reached out. And like she said, I gave it a few days, but I went to Amanda first, and then I went to Bryana because it is intimidating for the mentor as well as the mentee. And I think when you say, will I be your mentor? We're all mentoring each other right now. Just hearing each other's stories, passions, how we've taken our past. That's what mentorship is about. If we lock it into a box, you do need some standards, some framework, because it's the only way you can keep getting better. But we still have to remember that we, as a mentor, we're talking to another human being who will achieve more than we will. Because if they don't, then we really haven't contributed our part. You don't mentor for someone to be where you are. You mentor for them to be past where you are so they can turn right around and mentor, reach back, and give you a helping hand in an area. And for Bryana, she was very clear in her communications. I think we were fortunate. We were. I felt like we connected from the beginning, but both of us with a little, acknowledging. We're a little nervous. There's a little shyness. And I email her when I don't need a quick response. And I try to only text her if I need a faster response because I want to be respectful. This is a professional who's not only caring for patients, but she's caring for other nurses. She's at the bedside. She's just gotten a promotion, but she did the reverse. She told me, I prefer to know if you've got things you want me to cover when we meet, if you could send them to me in advance. And if I did that, she would respond back. And if I gave feedback on an email she might have sent and said, hey, what if we do this? She was quick to say, oh, thanks for sharing. But she also demonstrated why MGMA Mentorship is selecting good people because it is who it is. You can join MGMA no matter who you are, but the truth of the matter is only high quality people like Bryana choose to join MGMA. So when she joined MGMA, it's almost guaranteed I'm going to get a good mentee. And that's what I love about the mentorship program. Because MGMA has a great reputation and a foundation, it equips the mentorship program to have good mentees coming in and hopefully great mentors contributing out.
Yeah. Delores, you and I emailed back and forth. We shared a phone call a while back, just getting to know each other. I want to read something because I was responding to one of your emails, and I saw your tagline down there at the bottom of your email. So let me look down here and read this. It says, It's not about you and it's not about me. It's all about the we in all caps. We are stronger together. So I love that. I asked you about it then, and I'm asking you about it now. What is that philosophy? Why did you come to that particular quote that you wanted to put on your tagline, so every time you send out an email, people get to know Delores a little bit better about what you stand for? So talk about that philosophy of life and mentorship and leadership for you.
The we goes beyond the patient that a nurse, a doctor, an administrator will see. The we is you and me. And so often we hear the I's. So often we see the finger pointing the you. And we forget that we arrived at wherever we are because we had a part. And when we stop focusing on the you or the me or the I's, and you say, it's not about you. It's not about you and the mistake you made. It's not about you and the accolades you've achieved. And it's not about me and the weaknesses I think I have and me and the strengths I think I have. It's about we. When we recognize that, Daniel is pretty phenomenal at doing podcast interviews. And Bryana is pretty awesome at not only being a nurse, but being an educator and a preceptor to student nurses. And Delores is so passionate about just being a servant and helping any way she can. When you put all of that together, I guarantee you patients all across the United States are going to be better cared for, because there was someone who got the word out like Daniel. There was someone like Bryana who was willing to teach, share, precept, coach, support. There was someone like Delores who said, how can I help? And I get out in the community. I've been volunteering for over 20 years in any facet I can find, including healthcare. When it's not about you and it's not about me, and it is about the we. We are stronger. The United States, the world, healthcare, MGMA, the mentorship program, the Bryanas of the world are so much stronger to accomplish their destiny when we make it about the we.
Wow. Delores. Bryana.
She's amazing. I can't.
There's nowhere to go from that except to say thank you for being part of the MGMA Member Spotlight podcast, to both of you, to Delores and to Bryana. Thank you for being part of this.
It's awesome to be a part of MGMA. And Bryana, I sent you some emojis saying how proud I am of you, but how in awe and just so thankful that you were willing and are willing. Bryana and I are not aiming for just a check box. We recognize that we may not speak every day, every month. We may speak once a year, but I am confident that our paths are going to continue to cross. And I'm looking forward to when I can fly to Florida from North Carolina, because I told her, I said, if I'm ever in Florida, I definitely want to meet her face to face.
That's wonderful.
Yeah,
well,
absolutely.
That is going to do it for this episode of the MGMA Member Spotlight podcast. I want to thank Delores and Bryana for being here. And I want to let everybody know, if you're an MGMA member, if you want to know about this mentorship program, I will provide a direct link in the episode show notes. You can go right to it, learn more about it. Get in contact with Amanda Jensen. She can share a lot of that information with you. And so until then, thank you for being an MGMA podcast listener.